And I'm the Training and Education Program Manager on the Training and Education team here at MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series. This is a component of our tobacco treatment and prevention education and training program, and it's sponsored by and brought to you on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. So this webinar will be recorded. It will be posted on our website following the presentation today. We are offering one continuing medical education credit and one CHES credit for this webinar, and it will be sent to those who attend the entire session. In order to claim CMEs, you must have a profile in Cloud CME. If you already do, you will find your credits in your profile within a week of the event. If you do not have a profile in Cloud CME, you can find instructions on how to make a profile in the post-webinar email. And for those of you that are collecting CHES credit, record of your attendance will be sent to NCHEC after the webinar. And only those who have registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive CMEs and CEUs, as we're required to verify those who attend the full session. In addition, at the conclusion of today's webinar, an evaluation will appear on your screen as well as be sent to you via email within 24 hours after the event. We do encourage you to take time to provide your feedback. It's not only helpful to us in planning our webinars, but also to our presenters as well. So today's webinar is titled Addressing Youth Tobacco Use, Key Treatment Strategies, and is presented by Dr. Edward Bender, of MaineHealth. Dr. Bender is a child psychiatrist working in Portland, Maine. He has worked in varying degrees to support nicotine cessation for the past 20 years and relishes opportunities to share what he has learned. He earned his MPH from the University of Rochester School of Medicine and Dentistry, his DO from the University of New England College of Osteopathic Medicine, and completed his residency in psychiatry and fellowship in child and adolescent psychiatry at UMass in Worcester. He is a former American Academy of Child and Adolescent Psychiatry Legislative Fellow, current Political Action Committee board member for AACAP, PAC, and legislative chair for the Maine Regional Chapter of AACAP. When not at work, he enjoys spending time with his wife, his two boys, trail running with his family dog, and karaoke whenever he can find a willing party. Okay, before we begin, just a couple more housekeeping items to share. As this is a webinar, attendees will remain on mute to minimize background noise. The raise hand function is disabled for this event. Please feel free to submit questions during the presentation using the Q&A box. We will address them as time permits at the end of the webinar. If we are unable to answer every question live, we will actually provide a follow-up post-event email and collect responses to those questions that are unanswered. And for your convenience, a copy of the presentation will be sent out via email after the webinar. At this point, I'd like to turn it over to Dr. Bender.
Thanks, Alicia. So
Absolutely.
I'm really glad that we can meet today, and I'm hoping that this can be a helpful extension to prior lectures or talks that you may have attended previously, but also expect that this is not going to be exclusive of all the information that you could possibly learn. And so hoping that along with any of those questions that Alicia was encouraging that you might post or that we might follow up with, that you can use this as a foundation to continue to expand your understanding of sort of working with youth around tobacco use and any of the challenges, but also strengths that this period of time can present. Just noting that I don't have anything to disclose, and really quickly, just trying to touch on some of the key points that I'm hoping that we can touch on today, and equally helping to reinforce that these slides that are part of this talk, there's a great deal of information, and hoping that these can be shared with you afterwards, because I expect that we might cover a lot of ground and it may be helpful for you to be able to review these if we don't have a chance to go into all the minutia or hope to come back to some details. But really looking to cover some specifics around how neurocognitive development during adolescence presents challenges and opportunities around addressing tobacco use and the potential for addiction, how there is a distinct need to intervene and to be engaged in this period of time due to the potential for long-lasting ramifications later into life if tobacco use begins, considering how we might do that, discussing some of the ways that we can enhance motivation and ways that this may be specific to teens, but also potentially more universal to working with humans in general. And then also discussing some of the guidelines and best practices around pharmacotherapy in engaging youth tobacco use. So there's a great deal that has been written about adolescence. Most of us can consider what it means to be a teenager, either based off of our own experiences growing up, having been a parent and raising a teenager, and or just common knowledge of sort of what that entails. And many of us often think about physical growth that is certainly present, but adolescence is also a remarkable period of time during which there's an expansive amount of neurobiological growth and development. And this is responsible for many of the things that we also may conceptualize during this period of time. So as individuals proceed through adolescence, in the first half, they begin to develop an opportunity for abstract cognition. Their processing speed increases. They begin to develop a more complex understanding of themselves and how they as an individual also fit within a broader system and in contrast to others, and begin to have a different appreciation for the differences and the depth of understanding as to how others may perceive them. This in itself is part of what has been understood for generations around how adolescence can be a complicated time, and is also something that helps with advancing into being an adult, being able to conceptualize things in a more abstract and complicated way, and really coming to be an adult. The strength and weakness that comes in this period of time is that nature presents us with this unique opportunity of suddenly being able to understand that the universe is vast and that we fit into it, and also that there's this lag time in which more complex executive functioning, thinking through things, being able to weigh the risks and benefits and the potential long-term ramifications, that development, that subsequent interneural connection to our prefrontal cortex, that comes online in the latter half of adolescence and into our early 20s. And in some ways, there's a positive to that, because that allows us to perhaps take some risks in adolescence, that allows us to grow and have new experiences, but also can correlate with some of the things we think about around risk-taking, impulsive decisions, not thinking about the long-term consequences. And that creates a delicate balance for many. We also know that this is a period of time in which relationships really begin to advance from the preteen period, in which family is the primary social frame and structure for the individual, and peer relationships are largely based off of shared activities, into movement away from the family to become more autonomous, and peers holding greater influence as relationships become more complex amidst that greater understanding of abstraction. And that there's a strong influence of social experiences reinforcing and supplementing that ongoing neural development. And this plays a role as we also conceptualize how we're going to work with teens in this period of time, and why it's important to be considering these multiple factors. One of the things that can be important to also emphasize amidst all of this is, as we're going through adolescence, this is a period of time that we're beginning to establish our norms for what we understand to be standards of daily experience. We begin to set up habits and new routines, and we also start to lay the foundation of how we manage stress, how we regulate our emotions, all of these other factors that then continue on into later life. Because this is a period of time amidst this neural growth that our brain is setting up this new foundation, really reinforcing this new level in the house, so to speak. And as this is taking place, we're really laying the foundation and are influenced by factors that help us to adjust these norms and standards, whether for good or for ill. And so this leads into a real emphasis as to how the adolescent brain is uniquely susceptible to potential addiction, but also that we have a unique opportunity to potentially help uh, support any protective factors that are there and really help to reinforce them in a way that may have a sustained force into someone's adulthood. So just reiterating what was on the prior slide and what we had discussed there, we know that adolescents are at risk of being often more impulsive, especially in the early half of adolescence, because that prefrontal cortex is yet to really advance in the same way that the rest of the brain does. And that sometimes this can work in concert with an adolescent's beginning preference to defer to peers versus adults or parents, and that this may present a perfect storm of challenges amidst risk-taking and not considering long-term impacts. We equally know that substance use, and particularly tobacco use during adolescence, has an impact on altering the developmental course into later life. This exists both in terms of its potential impact on cognition, and we see that preteen use and early adolescent use of tobacco products correlates with impairments in memory and attention in the moment, but later in adolescence and into early adulthood. But we also can appreciate that this correlates with an alteration in that baseline emotional regulation that I was mentioning earlier. If an individual is using substances, using tobacco in this period of time, it's starting to skew what the brain understands to be the norm, and it can contribute to the challenges later in life of breaking this addiction because there's that much extra to contend with. It is beyond just the physical addiction to the nicotine. It also creates this shift in understanding how to manage stress, how to manage one's emotions without this product, because it's been present in this period of time when the norms are being set, when the foundation is being laid. And this is something that's important for us to consider, both in terms of how we are approaching things in working with teens, but also as we're considering work with adults later in life and when they may have started. And that really is sort of what's conceptualized in that third bullet point, and also coming back to why that's important as we consider working with addiction. So I'm not going to go into a great deal about the nature of addiction, but I include this slide just as a point of reference as we consider what addiction is, why this is relevant to our discussion around tobacco use. And largely, it really helps to reflect that there's a problematic use of a given substance, in this case, tobacco, that's causing impairment or distress in someone's life, but really narrowing in on how this is relevant to this period of time of growth in adolescence. This substance, the tobacco, is really, the nicotine is really activating the natural reward pathways that are present in the brain, but doing it in a more potent and intense way than would normally be there. This is particularly relevant when we're considering, again, this period of growth in adolescence, because this is skewing those standards and norms that we would otherwise be able to develop. So the normal reward system that would be present with a goal or an achievement, that standard, that baseline, that norm gets skewed for the individual that is using tobacco, that is using other substances in this period of time. And those natural rewards may not hit as hard, may not be as reinforcing, and it can create a skewed norm. So it's important for us to discuss that and just reinforce, which is probably a old hat for those in the audience, but when we're talking about tobacco and tobacco addiction or dependence, we're really discussing this critical element that's innate to tobacco, which is nicotine. And nicotine is a truly unique substance, and that's part of what makes things so complicated. It's unique in that it simultaneously provides a stimulant quality that helps with focus, as well as an anxiolytic or anxiety relieving quality. There's few other substances on earth that we know or that are able to do that simultaneously. That makes it quite addictive, as well as the fact that it is working on very primitive pleasure and reward circuits in our brain, those very same circuits that are really being reinforced and being further developed in that period of adolescence. And that really connects with or correlates with its innate qualities and just addresses many of those factors that we've already discussed in terms of risk factors and challenges that it can pose. But nicotine in itself can be risky, can be dangerous. There are certain factors. We know at very high amounts it can be risky. We also know if someone has pre-existing cardiovascular disease that it may spur ischemia. But the greater risk that we often consider is the means by which people obtain nicotine. And often it's that delivery method and the subsequent chemicals that it entails that create a health risk, whether that's the smoke in the cigarette, the other compounds within the vape liquid, or the chew or the nicotine pouch that pose the health risks. And equally, these devices have been produced and reinforced and revised over decades to ensure that they are as addictive as possible. Cigarettes have been carefully cultivated over the past 7 to 8 decades to ensure that they provide the most efficient delivery method of producing and providing nicotine to the brain as quick as possible in 8 to 10 seconds. And similarly, we know that the nicotine that's provided through vape liquid in nicotine salts are more readily absorbed into the bloodstream, both by the vape cloud that's produced being more easily inhaled because it tends to be less irritating, so a bigger bolus can be taken. It can be held in the lungs more readily and more absorbed, and the salts themselves equally correlating with the higher absorption. This leads to higher plasma levels of nicotine overall and can increase that potential for abuse. The crux of all of this, outside of the discussion of the potential harms that come from the delivery method or the addictive qualities of it, is really to reinforce that it's far more than just a matter of willpower to address nicotine addiction at any age. And we'll come back to this, but just emphasizing that. The fact that youth are drawn to tobacco is not an accident. Big Tobacco has been involved in this process for nearly a century. And we can see that Big Tobacco had authorized the use of designs of their packages of their designs similar to their tobacco packages on packs of candy cigarettes and chocolate cigarettes as far back as 1939. But we also see that through the advertising campaigns and the child level marketing practices of Joe Camel and similar mascots in the 70s, 80s, and 90s, and even as recently as the late 2010s in the grassroots marketing campaigns of Juul. And this is not by accident. Big Tobacco does this because they know they need to replenish the rolls, because they have a product that leads to significant medical morbidity and death, and they need to have a way of replenishing the rolls. And also they know the same neurobiology and neurodevelopmental factors that we were discussing at the beginning of this talk. They know that youth are at risk at this period of time, and that if they get someone hooked at this period of time, it is that much harder for them to quit. So they have an incentive to do what they can to make sure that they continue to get new customers. So if we were to consider some positives, there's some good news. In the past 5 decades, we see that the number of high school students that are reporting that they smoke has significantly decreased as a real positive. And this really helps to reflect very considerable efforts that have been taken towards education, prevention, and general outreach and efforts to address tobacco use in all ages. So positively, we note that in 76, 28% of high school seniors had smoked, and most recently we see that 1.7% of high school students report smoking. So that's a notable improvement. However, time continues. And we see that vapes and e-cigarettes have really stepped into the void that's been left by cigarettes. This is not necessarily to the same extreme, but it still is noteworthy, and it remains something that persists and has existed on our radar for a decade now. And one of the things that is important to note in these statistics is that while we see that around 8% of high schoolers report current use of vapes, of that group, more than 1 in 4 report using it daily, and of those using it daily, or of those reporting current use, we see that 38% report having used for 20 of the last 30 days. What is equally really critical for us to consider is that we know that the vast majority of youth that are vaping are using flavored e-cigs, and fruit flavors are the most common. This is not by accident. This is a well-cultivated effort by the industry to create products that are appealing to youth in bright colors and in fruit flavors. And equally of note, we know that there have been efforts on the part of federal and state-based legislation to try to help address this, or to help to address issues that we see. So in the late 2010s, as the prior slide had noted, we know that Juul had been aggressively marketing their products and fruit flavors towards youth. There were efforts to really address that. And we see that that is correlated with a shift from what had been a more prevalent use of vapes with utilizing carts or pods to what is now the current majority standard of disposables being the most commonly used products in youth. And that seems to reflect that shift in that void that's been present in legislation and regulatory factors. We also know that there are always new products being developed, and that this continues to sort of skew our understanding of what we need to be considering. And so we know that in the past few years, there's been an increased presence and use of nicotine pouches. And while it certainly is yet to be on par with those of vapes, it is still a thing that is important for us to be considering, both in terms of when we're discussing use or the extent of products with teens, but also how use may be more present than we might otherwise consider. So similarly, we see that the majority of pouches that are being used by youth are flavored, and that it appears to be the inverse of vapes, where there's a greater majority drawn towards mint flavors versus fruit flavors. But all of this is really just to help to emphasize that as cigarette use has decreased positively, there are these other elements that we still need to be considering. So just coming back to that point around those fruit flavors and any of that specific packaging, marketing, any of the rest of those factors, one of the things that is important for us to consider is that research indicates that those flavored e-juices are not by accident. Not only is that appealing to youth, but also we see that the sweeter the flavor, the greater the potential for dopamine release. All of this is done, again, with the emphasis and interest of helping to further and reinforce the potentially addictive qualities of these products, and really help to, again, create a customer for life. So what can we do with this? The thing that we know is that it is the biggest impact we can make is to really work and continue those efforts towards prevention. If we can help to prevent the initiation or that first trial or that first experiment, that goes a long way. that really helps. And so we want to be able to sort of have that outreach, continue those efforts at education, continue those methods that we know to be true, or continue our efforts to continue to explore other interventions that may make a difference, and to continue those efforts, because if someone doesn't start, there's less of that chance that the brain is in that space of vulnerability, or that there is any risk of that persisting. It's equally important for us to be honest and direct around the nature of addiction and tobacco. So it is important to emphasize that even in vapes that market themselves as not having nicotine, to a large degree, the e-cigarette market in the United States is largely underregulated, and there's a great deal of documented variance that exists in the nicotine concentration of vape liquids, with many that market themselves as not having nicotine actually having quite variable ranges of nicotine, from mild or moderate to quite significant, despite what it says on the label. So it's important to emphasize that even if a youth believes, oh, this is just fruit flavored, this is fine, there is a good chance that it may not be. And that the nicotine that's present in a vape is still addictive. And there's a potential that it may actually be more so, as we were noting around the way that it's delivered, those nicotine salts, and the potential for it to correlate with a higher plasma concentration of nicotine overall. And it's equally important to, at the very least, bring up, if you're having a discussion with someone that is considering vaping or is vaping but just recently started, or anything in that factor, to clarify that most teens, in fact, aren't vaping. And even if there's elements that exist amongst one's peer group, and we know that that can be significant and influence, that we know that the majority of youth are not, in fact, vaping. So how do we talk to youth? How do we talk to teens? Many of the same principles that exist in speaking with adults are just as important and still present and relevant in working with folks of any age. The first and top priority is really addressing the human that is before you, beginning to try to understand and explore what are their interests, what are their goals, what are the things that they hope to accomplish, or their priorities. This could be something that's a layered, nuanced, and challenging conversation with teens, depending on where they are in development, because innately this is a period of time in which goals and priorities are being established. As an individual understands themselves better, they begin to understand what it is that they want, what it is that they're passionate about, and begin to crystallize those elements. But even if this is something that's in transition, it's still pertinent to understand what's important to them in this moment. Those are really ways to be able to create connection that then helps amidst any discussions, whether prevention or intervention. You equally should be considering sort of where someone is in their point in development. We know that younger adolescents tend to be more concrete in their cognitive framing and understanding, and they might benefit from slightly more direct guidance and providing things in a more structured and finite and concrete way, versus older adolescents who are tending to trend more towards young adults and have greater tools of abstraction. And they're likely to benefit from really helping to emphasize the strengths and skills that they already have and draw from those, work with them in consideration of those factors to adjust the treatment plans that you might be developing and that they might be encouraged to consider themselves. And it's really important that we, again, consider how relationships become increasingly relevant and critical in our understanding as one goes through adolescence. And it's important that we incorporate peers, romantic interests into discussions that we might have, especially as we're developing a treatment plan, but also that we don't exclude family as well, regardless of someone's age, because they're equally important and equally influential regardless of someone's age, even if the individual before you is strongly focused on their independence. in a developmentally appropriate way. It's still pertinent for us to be able to discuss the benefits of quitting at any age, and part of that is because we know that regardless of how old someone is and how long they've been smoking or vaping or dipping, it's still potentially the most impactful decision that they can make to quit and to give that up. And we know that this is relevant at any age, and even if the immediate health risks have not accumulated as extensively in someone that's an adolescent, if we intervene earlier, that has physical benefits as well as cognitive benefits in terms of that reduction in risk. One of the things that can be important as we're discussing the methods, the motivation to quit, it's important that we consider that teens may or tend to be more likely to appreciate more immediate benefits from these efforts at behavioral change around how that might influence their athletic performance or their work in school or the savings that might be produced versus any of the long-term health risks, although it's still important for us to emphasize the benefits that can be present as they're making this change. And again, just circling back to slides a few ago, we know earlier that we intervene or methods that we might have to prevent are going to correlate to a greater benefit overall. Again, reiterating something from a few slides ago, it really is more than just a matter of willpower in order to be able to quit tobacco use, and that really reflects the addictive qualities of nicotine. And that is equally present when we're considering youth, because it may have this very significant impact of, even though it's perhaps very isolated or very brief use, that can have quite a significant weight in this very critical period of development. But regardless of someone's age, we're starting from the first point. And again, trying to understand the individual's specific goals and interests and what it is that they're passionate about, interested in, and then how does their tobacco use fit within that frame? And if they were to give that up, if they were to change, what would make that difficult and what would that present as a positive? We know that the more that we can really personalize those things and make it something that's innate to the individual and their intrinsic interests, values, priorities, that is going to be something that we see correlates with a greater likelihood of sustained and lifelong change than things that are external and extrinsic motivators, money, fame, concrete rewards. Those can still motivate, but the shine wears off over time. So the more that we can really dig into the person in front of us, what they're passionate about, interested in, pursuing, and tie in any of these changes, any of these discussions into that, that's going to really provide us access to something that is more innate to them and more personalized. And the more we grasp some of these elements, the better able we are to really help cultivate a more qualitatively rich quit plan. A quit plan is something that's important for us to consider regardless of someone's age, and really that's just because we know the more we've worked to specifically address the elements we know to be vital amidst a significant behavior change, especially when it comes to dealing with something as addictive as nicotine, the greater someone's likelihood for success, or at the very least, we've enhanced their awareness so they know what might be coming. And that becomes even more important if we're considering working with adolescents who, again, may not immediately think of the long-term consequence, even just in terms of sort of what might be coming in a week or two without nicotine. So it's important for us to be covering many of these elements that we would consider in working with adults when setting a quit plan around discussing a quit date, considering those relationships that are important, again, exploring what are going to be the places where the tobacco has existed to date and how might we address that. And this is often a conversation that is eye-opening for teens because they may not have even realized how extensive that tobacco use has been in their life, especially when it comes to a vape that sometimes is easier to use without requiring stepping outside. Similarly, it's important for us to consider medications, but there's some important caveats to this. I'm not going to spend a great deal of time talking about withdrawal symptoms, but I do think it's important for us to bring this up in discussion so that teens are aware, as we're discussing these things, that there is withdrawal from nicotine and what they should be aware of might be present as they're going through the process, how they might experience that, how they should understand and interpret that, and providing a understanding of how long this should last. It's important that we consider the role for medications as a means of helping to address that addictive quality to the nicotine and the struggle that can be present as someone is looking to break that pattern and addiction and dependence that's present around its use, and that this is something that there's no reason or no evidence to understand being any different for youth than it would be for adults. And we know that when it comes to using medications with adults, that it's increasing their potential for success because it's really helping to counter that chemical addiction dependence, that role, that void that's created when the nicotine is taken away in the way that was previously delivered when smoking, vaping, dipping. But one of the things that's really important for us to consider is that currently there is no FDA-approved medication for the treatment of tobacco dependence in youth. But we know that there are tangible risks from ongoing use of tobacco, and that the risks outweigh any of that lack of approval and or certainty and or definitive treatment standards. And this is such that the AAP in 2023 had specifically provided recommendations around the use of nicotine replacement in teens that really helped to emphasize that there is no documented evidence of harm and that PCP should be considering off-label use in order to ensure that teens have a greater likelihood of success. There is no reason, there is no evidence to assume that teens do not struggle with cravings or any of the other withdrawal symptoms, and equally, there is no reason that we should deprive them of the likelihood of success by considering and incorporating these tools into their quit plans and giving them that likelihood of success. I'm not going to spend a great deal of time going into many of these agents outside of just helping to indicate that there are these standards that we consider. The AAP in their recommendation guidelines have really gone into the role or use for nicotine replacement therapy, but I'm touching on some of these, I'm just briefly mentioning these other two medications specifically in consideration of their use in addressing tobacco dependence, and with the caveat that just as with nicotine replacement, bupropion or varenicline, neither of those have been studied extensively in youth, but they are used off-label and may be relevant considerations depending on what you're seeing before you when working with youth. Not going extensively into this, but briefly touching on nicotine replacement therapies, just as a refresher, these medications exist to provide nicotine in a defined method through various delivery mechanisms. And the idea there being that it's a means of providing a measured amount of nicotine without the harmful compounds that would be present in the smoke or the vape liquid, and doing that in a slightly more controlled and slower way to reduce its potentially addictive qualities, but also counter the potential hindrances that can come during that withdrawal process. There are many that are available. The challenge that can be present is that these aren't available to those that are under 18, but often will work with families or PCPs to help find ways to be able to ensure that folks have access. And often it is a worthwhile process to consider that to enhance success. Quickly going into these other two medications, but not extensively, bupropion is an antidepressant. It is working uniquely on norepinephrine and dopamine. And we see that it helps for some to reduce cravings, anxiety, depression that may be present in the withdrawal process, and can enhance the likelihood for success, but that there are some unique potential risks or side effects that are present, including the risk for suicidal thoughts that might be present with youth and young adults in general, as well as a increased risk for seizures if an individual has a history of head injuries, they're engaged in heavy alcohol use, have a pre-existing seizure disorder history, or have a restrictive eating disorder, and that this medication may worsen restrictive eating disorders for some. Lastly, varenicline or Chantix, we know is a unique agent that specifically targets the nicotine receptor, and that may reduce cravings or pleasure that comes from ongoing use of nicotine through cigarettes or vapes, and may be a consideration. But again, this is a medication that has not been studied extensively in use and is not FDA approved, but may be a worthwhile consideration. We know that for adults, combinations are more effective, and there's no reason to assume that this would not be the case if you have a youth that is using significant amounts of nicotine every day, but just emphasizing that this is even more so not something that's been studied extensively in youth. And questions often come up, is it worthwhile to consider vaping in order to quit? And the jury is out when it comes to adults, and there's even less information when it comes to youth. It's possible that e-cigarettes may prove to offer a pathway towards helping to quit, or do that in a way that perhaps may reduce the potential of exposure to the many harmful compounds that we know are present within cigarette smoke. That said, it is hard for us to know, and it is equally a bit more daunting if we're considering this within the context of America, where vapes may not be as tightly regulated as other spaces where they may be considered as a potential means or tool in quitting. So in the UK and New Zealand, they're more tightly regulated. They are considered at times a tool, but that's because it is a much more narrowed and tight market that provides more of a certainty to the professional advising this potential use. So just circling back to elements around motivation and ways to help to enhance that, regardless of the age of the person that we're working with, it's important that we're listening and that we're helping to incorporate those elements that we are pulling out from that conversation and that curiosity to better understand the nature of that person's use, how that fits into their life, helping them to understand that, and then helping to incorporate that into their plans and their motivation and goals. And also considering the pitfalls that may be present, and that in youth often may also incorporate considering or discussing how they might navigate situations or challenges that present with interacting with peers or in social situations in a way that might be different from working with adults. And it's important that we consider family norms, standards, dynamics, and how we might be able to incorporate family members in a way that's supportive or helpful for the youth before us, but that we're working with the patient first and foremost in any of this discussion, so that they're in the driver's seat and they don't feel put upon. Again, looking to help to make sure that we're enhancing that internal motivation instead of contributing to a sense of it coming from outside. And it's really important at any age for us to really reinforce the fact that any quit attempt, any effort towards change is an opportunity for us to learn more about the nature of our use, dependence, and be able to grow with that knowledge to help develop more robust plans in the future, more informed plans in the future, rather than it being a discussion of success or failure. Not going into extensive detail here, other than to emphasize that it's important to advise that if someone is looking to quit, whether that's cigarettes or vape, that if we're taking nicotine out of the equation, that may skew how our body is processing other medications or other substances, most notably caffeine. And so when someone is quitting, it's important that you give them a heads up that, oh, you might feel the caffeine more because it takes your body longer to break that down. And if you're working with someone that regularly drinks a large monster, maybe they should be advised to have half of that as they're going through the process of the quit. Unfortunately, we're running out of time, so just noting that there are certain groups that may be at enhanced risk as they're going through the process of quitting, or even just that they have reduced access to care or greater likelihood of using tobacco, and it's important to be considering that in those discussions. And we don't have time for case studies today, and really quickly just touching on the fact that we have a unique opportunity in this period of time. We want to really focus on prevention, but it is not a lost cause to be intervening at any point. There are notable differences in the products that are used by youth, and we need to consider that. And though there aren't any FDA-approved medications, it's really important that we aren't excluding medications in our discussions as we're trying to help youth to quit. And it's important that we also consider additional resources, including resources such as My Life, My Quit here in the state of Maine, that is specifically directed towards teens and provides tools that and delivery methods that may be more relevant and pertinent to the communication methods that they currently use. So there's plenty more that we could discuss, but given that we are under the clock, hoping that this might provide an opportunity for us to perhaps briefly address a few questions that may have come up during the discussion.
Thank you so much, Dr. Bender. There are a few questions, and I welcome additional ones coming in. So the first question, any truth to a pure, quote unquote, pure nicotine being used for purpose of academic focus and or behavioral health, mental health, ADHD patients?
So certainly it's a thing that is discussed in certain circles, and certainly it is a thing that you may hear amongst people that either are vaping otherwise, smoking otherwise, or anecdotes of folks using nicotine replacements as a academic enhancement. There's little in the literature that I have read to date that speaks to it serving as an alternative treatment for ADHD or as a means of cognitive enhancement per se, or that helps to argue its role in that way. Certainly, again, case by case, you might hear people that speak to that as a use or as their part of their motivation or their reluctance to be able to stop using. But I'm not aware of anything that shows that as a validated method for that purpose. It's not to negate that it couldn't help with focus, but it is to emphasize that there are likely other products or other medications or tools that may be potentially less addictive or risky to consider.
Thank you for that. Curious to know what strategies can be employed to combat stigma among youth and their parents about seeking treatment or cessation options.
Hmm. So I think it can be challenging because it depends on sort of what's being considered stigma. But one of the things that, again, depending on the cultural and additional sort of specific norms of a family or where like, any other factors influencing or surrounding the youth that you're seeing in front of you, addiction is not a moral failing. It is not something that someone has done wrong or that a family has done wrong, and it is not something that is any it is not unique to an individual. It is something that by our nature as human beings, we all have the potential for. And if someone has started use, it doesn't mean that they're corrupt, that they've done something wrong. Any of us have the potential risk of having made a decision, especially during a period of youth, that may have consequences, may then prove difficult to change. And so regardless of whether we were discussing tobacco or even if we were discussing harder drugs, the thing that's important to us now is to acknowledge that addiction is quite challenging, is real, and requires support and efforts to help address that and deal with it. That may require a more nuanced conversation with a family if there's greater objections or concerns. But if someone is using nicotine, if someone is using tobacco, it is not, it should not be a judgment as to a parent or a family having done something wrong or an individual being a bad person. It is the nature of being a carbon-based life form and us having to deal with some of those factors that are innate. And the more that we can help to emphasize that addiction is multifaceted, but in some ways reflects the just the struggles of us dealing with neurochemistry and us dealing with the fact that our brain is susceptible to those things and that makes things challenging, that it isn't that we've done something wrong. The more that we can keep things grounded in fact, the more that we can keep that separate from the person and their innate worth, that often goes a long way and can help to sometimes also preempt any of those judgments or feelings of shame that the individual or the family might feel.
Thank you, Dr. Bender. Do modern day nicotine products contain more chemicals than in pre-vape nicotine products, which makes cold turkey quitting, quote unquote, more difficult because of today's nicotine additives versus the original form of tobacco cigarette form?
Hmm. So I think it's challenging because if we're looking at products like vapes or these pouches, there's a fair degree of variability between products, and a lot of that is proprietary. And so it can be that much harder for us to know with certainty between products. How do they differ? How much might that influence things? If we're speaking specifically about cigarettes, one of the things that can be important for us to consider is, on the one hand, methods of cultivation of the tobacco itself have, just like many other aspects of agriculture, really progressed in the past century. And it's very likely that the tobacco that's being grown is apt to be more potent, that the yields are likely to be greater, and even just the ways that it's being cured and then aged may also have been refined so that there's greater potency or presence of the nicotine. But further, as the cigarettes are manufactured, we know that there are various points in the manufacturing that have been emphasized to ensure that it's more addictive. Some of that is the placement of the air intake in the filter so that it ensures that a smoker takes a deeper drag, but some of that is even just the application of things like urea on the tobacco before it is rolled into the cigarette to make it more basic, to help to, again, enhance and increase the potential for absorption of nicotine with every puff into the bloodstream and enhance the amount of nicotine that is delivered to the brain with each puff. So I don't know if that specifically addressed the question. I don't know that there's necessarily inherently additional chemicals that are added outside of things like the urea, but I think that there's a number of factors that may enhance either by processes involved or by design.
Thank you. Given that most teens hide nicotine use from parents, is there any way for patients under the age of 18 to access the medicines without their parents' consent?
So sometimes this is a discussion that youth may have with their PCP or their psychiatrist or other medical providers, and can sometimes be a thing to explore or consider. There may be avenues, but often it may be similar to sort of if a youth is having a discussion about starting a medication for anxiety or depression, and that being something that may be more contentious. In a perfect world, there'd be an opportunity for any barriers or any challenges that might exist within a family to be discussed and overcome. But obviously that isn't always the case. And if someone is really struggling, the hope would be that they're able to work with their medical provider in order to be able to come up with a plan. And there may be various points that could be discussed. It may be that the PCP is able to write a prescription and be able to provide that to the youth, and they can find a way to pick it up, similar to if they were looking to start an SSRI for their depression. But it certainly does create a barrier, and the hope would be that over time, legislation and even FDA regulation is advanced to really reflect what we know is present by biology in terms of nicotine and how addictive it is, and that doesn't suddenly activate at 18.
Thank you. What do you recommend if parents are smoking at home and a teen wants to quit?
Hmm. So there is always an opportunity. We know that misery loves company. And so the adage that's always present, even when we're working with adults, is that one person quitting provides an opportunity for others to be dragged into it. So I'm not going to say that that's an easy conversation because I imagine that that can easily stir the pot, but there's always an opportunity to broach that and to be able to discuss the health benefits that would be present for everyone, as well as the potential health benefits that would be present for the youth of those other folks at home not smoking due to any of the health risks that come from second and third hand smoke. And so, again, it is not to be Pollyannish. It is not to open a can of worms. But we know that as people are going through the process of quitting at any age, that if they're doing that with others, it sometimes can help to enhance their likelihood of success, if nothing else, than because they can gripe about how they feel crummy and this was a poor decision and boy, I could really go for a smoke or a vape or a Zyn. And so there may be an opportunity there to discuss that. If not, it's important to be able to discuss with the youth and ideally with the parents what are the things that might be able to change in terms of the home norms or standards to reduce potential triggers or cues or exposure to smoke so that that youth has greater likelihood of success and they're less apt to struggle with cravings or temptation.
Thank you. What are pouches? I think we have time for one more. What are pouches and how are they used?
So innately, I think there are things like snus or other strictly tobacco-based products that are placed in pouches, and those are very similar to chewing tobacco, but they're in a discrete and specific pouch to help to deliver that. These newer products like On or Zyn, they are a bit more processed. They help to deliver that nicotine in a way that isn't directly, it's not browned or crushed or otherwise pulverized tobacco, but is a bit more processed so that the individual doesn't need to spit. And it makes it more discreet and cleaner, but um, it's also similar to vapes. There's a good chance that there's a bit more of a proprietary quality to it, and that may mean that there's a variation that exists between these products from one company to another in terms of how they go about processing the nicotine, obtaining it from the tobacco, putting it in the product, the flavors that are used, any of the rest of it. At the end of the day, it is whatever this processed compound and substance is, they place it inside a small paper or fiber packet, and an individual places that in their mouth and is able to absorb nicotine relatively quickly through the buccal mucosa or through the other points in their mouth, and still provides that nicotine in a relatively potent and effective way, and can present challenges because unlike even vapes, these can be things that people can use in settings where even vaping is prohibited. So we see that folks may be using them, at least adults we see using this in sporting events or when on planes or in other settings where they wouldn't be able to smoke or vape otherwise.
Thank you, Dr. Bender. So thank you so much for all the information today. Once again, the webinar has been recorded and will be posted to our website. Any questions that we were unable to get to, I'll work with you, Dr. Bender, to get responses to those, and we'll send those out as well in a post webinar email. Just a reminder, in order to claim CMEs, you must have a profile in Cloud CME. Instructions can be found in the post-webinar email that will be coming later today. For those that are collecting CHES credit, it will be sent to NCHEC after the event. You'll receive information, a copy of Dr. Bender's slide deck, the handouts, and all in the post-webinar email. And additionally, we do value your feedback. So please, when an evaluation appears on your screen, if you could take a few moments to provide your feedback. If you have additional questions that we were unable to get to, always feel welcome to email our tobacco training at mainehealth.org email address. And again, thank you, Dr. Bender, for your time today. And take care, everyone. Thank you.